Good morning. I'd like to call the Committee of Health and Human Services to order. It is Thursday, February 22nd, 2024, and we have 5 bills on our agenda today. The first bill we're going to take up, Senate File 1522, Senator Kupec.
Thank you, Madam Chair. Good morning. This is going to sort of be like the movie Groundhog Day because we saw this bill before. And nothing really has changed from when we saw it last year. We passed this last year. Unfortunately, our counterparts over in the House did not take it up. So we are back this year, and hopefully we will get this through, because this is a couple of kind of simple yet fairly important bills. So the first bill is Senate File 1522. This is a vet tech licensure bill. This would provide a voluntary pathway to licensure for vet technicians. Minnesota is one of only 8 states in the country that do not regulate vet techs. There are presently no professional requirements needed for them to work in veterinary medicine, a job that includes dispensing controlled substances, educating the public on health, welfare, pets, and animals. The legislation would improve veterinary practices and efficiencies through greater utilization of vet technicians, would recognize the education and skills that credentialed vet technicians possess, and will lead to improved working conditions and retention. It would improve and enhance public safety by requiring accountability and oversight with a mechanism to investigate misconduct like drug diversion. Licensed veterinary technicians would be defined in the bill, but licensure is not mandatory. So again, it is not mandatory. If you want to continue where you are without getting the license, you are welcome to do that, but licensure just opens another path, another career step, and potentially some higher earnings. Nothing will change except their title. So what does this do to expand veterinary technicians can do if they're licensed? With a growing shortage of veterinarians, a 4-year retention rate in the vet tech profession, this will help alleviate overloaded practices and make the industry more efficient. And particularly in rural areas where we are really short of veterinarians, and oftentimes calls involve long distances and driving out to farms, having vet techs take some of that load will ease the burden, particularly in rural areas. So I do have 2 testifiers to me today, and they can speak more to the bill and answer any of your highly technical questions.
Thank you, Senator Kupec. First, I have Kim Horn on the list.
Yes.
If you could please state your name for the record and begin. Thank you.
Thank you. Good morning. My name is Kim Horn. So thank you, Chair Wicklund and committee members, for your time today. And thank you to Senator Kupec for being chief author on our bill. I am the Credentials Committee Chair for the Minnesota Association of Veterinary Technicians. Vet techs play a key role in public safety by being competent in the recognition and prevention of infectious and zoonotic diseases in our companion and farm animals, as well as in wildlife. We are involved with client education, dog bite injury prevention, and we dispense and administer medications, including controlled substances and opioids. Veterinarians also depend on vet techs who work in research facilities and governmental agencies to improve public health in the areas such as disease prevention and food safety. This licensure bill aims to expand what a veterinary technician can do by creating a supervisory scope of practice, by allowing the veterinarian to supervise remotely and to delegate the responsibility of supervising non-licensed employees to the licensed vet tech will free up the veterinarian's time and more patients may be served. Licensure is not mandatory, so businesses can continue to operate as they are currently. But for those vet techs who choose to become licensed, they can be better utilized to increase efficiencies in our profession. We believe that fully utilized vet techs who have title protection are more likely to stay in the career field where Minnesotans can benefit from their education, skills, and knowledge. Licensure of vet techs will alleviate the critical shortages we are experiencing in the veterinary industry, and regulation by the same board that oversees veterinarians will benefit public safety. Thank you.
Thank you. Next, I have Dr. Ellen Belay, and I apologize for that if I mispronounced your name. If you can state your name for the record, please, and begin.
My name's Al Bailey. So thank you, Chair Wicklund and Senators, and thank you particularly Senator Kupec for being our author on this bill. I'm a practicing equine veterinarian. I'm a recently retired faculty member at Ridgewater College in Wilmer, and I'm currently the chair of the Minnesota Veterinary Medical Association's Veterinary Technician Committee. I have 3 points for you this morning. The Minnesota Veterinary Medical Association and the Minnesota Association of Veterinary Technicians have worked together to support this legislation with the intent of bringing Minnesota up to U.S. industry standards and reducing the shortage of veterinary technicians. We not only have a shortage of technicians, but I think you're aware we have a shortage of veterinarians in Minnesota and in the United States. The greatest shortage is among those of us that are large animal veterinarians outstate. Licensure of veterinary technicians has the potential to reduce some of the impact of this shortage. In this bill is a provision for remote supervision of the veterinary technician by the veterinarian. My second key point, there are over 2,600 voluntarily certified veterinary technicians in Minnesota through our association. As chair, I'm informed when complaints come to the association about veterinary technician misconduct, including theft of a pet owner's credit card and diversion of controlled substances. Because their certification is voluntary, our association cannot do anything. Unfortunately, these employees are usually fired, and unfortunately, they move to another veterinary clinic. We believe that licensure of veterinary technicians will provide state oversight as well as a mechanism of investigation through the Board of Veterinary Medicine and potential discipline for any misconduct. Additionally, we believe that they will have access to the state's health professional services program. Currently, they cannot access that. My last point. This bill language was developed using national models, including definitions and scope of practice. Both of our associations are working together to endorse a path towards licensure for veterinary technicians. Therefore, we have proposed voluntary licensure with a very lenient grandfather clause. We thank you for your time and ask for your support.
Thank you. And so those are the two testifiers, excuse me, that I have on the list. Members, do you have any questions for Senator Kupec or the testifier? Senator Utke.
Thank you, Madam Chair. And the one thing I was wondering even yesterday as I was looking at this, and you touched on a little bit of it here right now, is with the licensure, there's going to be an oversight part of it where you'd be able to keep track of these people, but is there an educational side to this? Is there some education that's required to be licensed, or is it just the background check and that sort of thing?
Dr. Bailey, did you?
Yes, thank you, Chair Wicklund. Thank you, Senator Utke, for your question. Educationally, veterinary technicians usually have an Associate of Applied Science degree, 2 to 2.5 years educational program. We've got 4 colleges in Minnesota, all of which Minnesota state colleges that offer the veterinary technician education, and they take a national examination to prove their proficiency. In addition to that, they have a current requirement for 10 hours of continuing education. In the bill language, other than the very liberal grandfather or legacy clause, anybody past that, anybody that goes beyond that legacy sunset will always have to have the educational requirements and having passed the national examination. We have suggested an increase in continuing education as well. The current national standards are average are 15 continuing education credits every 2 years, and we believe that will really help bring up the level of the profession. Did I answer your question, sir?
Senator Utke.
Thank you, Madam Chair. Yes, you did. The grandfathered ones come in and the education isn't part of it, but I fully see going forward the education is part of the new text and even the emphasis on increasing that. So they are going to have skills and such, which is good. Thank you.
Members, any other questions? I guess I didn't have other questions. I mean, it seems like a good proposal that we should move forward with. I mean, it seems like it will strengthen the profession, and then allowing the veterinarians to have some ability to delegate tasks does seem like a really beneficial beneficial for the field and helpful going forward. So I don't have other questions. Do you have any final comments, Senator Kupec?
No, I appreciate the support we had last year, and really excited that we can get this done this year, so.
And before I go any further, I do want to state that we do have a quorum present. So I forgot to say that at the beginning. Senator Kupec, we will be laying this bill over and for possible future consideration. And that's all I need to say, I guess, at this point. So the bill is laid over. And Senator Kupec has the second bill on the agenda. That is Senate File 1773.
And it's deja vu all over again. This is also another veterinary medicine bill, also another bill that we heard and passed last year. So Senate File 1773 allows the Board of Veterinary Medicine to issue an institutional license to practice veterinary medicine at the University of Minnesota if the applicant has obtained a degree or a doctorate from a non-accredited college of veterinary medicine or other requirements are met. A person obtaining this license can only practice at the University of Minnesota College of Veterinary Medicine. So this is a very specific bill just for the U. Senate File 1773 allows the University of Minnesota College of Veterinary Medicine to remain competitive in acquiring top talent from around the world while adhering to the strict standards of veterinary medical practices. So obviously, this is a case where we want the U to be competitive and to get the best talent they can, no matter where that talent comes from. And if we can just make the little tweak to the law, then these people who come from all around the world can teach and practice just at the U and bring those skills to the people of Minnesota. So I have Dr. Michael Henson here from the College of Veterinary Medicine at the U to add some more testimony.
Thank you. Welcome to the committee. Dr. Henson, please state your name for the record and go ahead with your testimony.
My name is Michael Henson. Thank you, Madam Chair and the senators, and thank you to Senator Kupec for authoring this bill. So I am a veterinarian. I've been on faculty at the university for about 30 years, and I'm sitting here today because our Dean Mulgard is away in Arizona. So thank you for having me. As has been mentioned before, there's a nationwide deficiency of veterinarians and veterinary technicians. And so universities are responding by increasing class sizes, and other states are also proposing additional veterinary schools. So currently there's 33 veterinary schools in the nation, and there's a proposal for up to 12 more. And so currently we have a deficit of clinical faculty to fill positions here at our university. And with the increase of additional schools opening, that problem is only going to get worse in the future. Added to that, the pool of individuals who we recruit for faculty are typically specialists, and there's a big competition for those same individuals in private practice now. They honestly get big signing bonuses and paid better than the university. And so the demand for veterinarians is growing, the demand for veterinary specialists and potential faculty is growing as well. And currently, we have a disadvantage in Minnesota because of the language in the statute. So we can only hire, as was pointed out, graduates of American Veterinary Medical Association accredited schools of veterinary medicine, or those specialists that have already achieved board certification. And you may not know, after residency, it can take up to a year to achieve board certification. And so those individuals might want to come to Minnesota, but they can't be employed here. Whereas in other states, their institutions of higher learning allow them to hire the best and the brightest from wherever they are around the world, wherever they were trained. And so we just want to kind of level the playing field with other states like Michigan and Missouri and Kansas and North Carolina. And so the proposed solution, as was pointed out, is a University of Minnesota institutional license to allow us to hire the best and the brightest, both faculty, residents, and interns. And all of the other licensure rules still apply. the license will be revoked if they leave the university. So this isn't a back door to getting a license in Minnesota. And it's not a lowering of the bar either, because we're seeking to hire the best and the brightest. And the university has mentoring programs and regular review, which is more than what non-university veterinarians are required to do. And so we're not lowering the bar, we're expanding the pool of candidates who could potentially work in our state. If you have the slides in front of you, I gave a couple of examples of people who wanted to come here and work at the university. We would not have been able to hire them as residents because of our rules. They were, because of other states allow this, these individuals who were trained at other outside our country obtained residencies in Boston and in Washington State, and they wanted to stay in the U.S., but because of the delay for them to become board certified and to practice here, they chose other options. And so we miss out on good opportunities. And so the risks of inaction, if we don't do anything, in addition to it not filling our faculty positions, there's also a smaller pool of residents and interns, and that's particularly a problem right now in large animal. As was pointed out, we have a deficit of veterinarians that are interested in large animal in the state and in the country. And so this potentially allows us to recruit those individuals that are interested in that field. It potentially can improve the diversity of our workforce if we pass this bill. And a very important part is that Minnesota is a big ag state, so our swine and poultry and dairy industries all rely on our diagnostic lab for disease surveillance and diagnosis. And right now we're having trouble hiring enough pathologists to do the work. And so with this bill, we're hoping to be able to maintain or improve the quality of education of both veterinarians and specialists, as well as support our ag industry. And so we hope that you'll support this bill. And I'd love to answer any questions. Thank you.
Thank you. Members, do you have any questions for the testifiers or for Senator Edke?
Thank you, Madam Chair. And this is just not exactly what's in the bill, but just because of where you're coming from, and you touched on a little bit, is how big is the shortage of veterinarian for large animals? Because we hear it all the time, how we're so short across the country. And just, is there a number that's attached to that, just for curiosity?
Dr. Hansen?
Madam Chair, Senator Edke, I would love to answer that question with data, and I don't have that, but I can get that for you. I hear the same things that you are and that you've heard about a deficit in the state and across the country, and we have programs. We've recognized this for a long period of time. We have programs set up to try and recruit large animal interested students, and so we've had that for more than a decade to try and correct that problem, and we've just recently partnered with South Dakota State University to add 20 more students to to those that are graduating. It's a 2+2 program, and again, the emphasis there to try and increase the number of large animal interested students. And so, but a specific number, I'm sorry, I don't have that handy.
Senator, any further questions? Senator Edke? Did you have further questions?
Madam Chair, could I just,
Senator Kupec?
Yeah, could I just add a little personal story to what you're, part of the reason what you're addressing. So as my role on the Ag Committee, we met last fall with students at the University of Minnesota who are coming out of their veterinary program. And there was a student from Frazee, and she wants to go back to Frazee and take over the practice of an aging veterinarian. He's ready to retire. But even to take over that practice, I think she was looking at $70,000. He hadn't updated things in a while, so she was going to have to invest more money in that. She's coming out of the U with a bunch of student loans. And one of the problems we're facing is that in the Twin Cities metro area, several big companies have now taken over most of the veterinary practices, and they're offering $100,000 salaries and sign-on bonuses. So in her mind, it's trying to balance that out. And it's so hard to get those people back for that, but it's little things like this certainly will help.
Senator Mann.
Thank you, Madam Chair. I have a couple of questions for anybody. So right now, if you get this institutional license, you can practice vet medicine up to your scope of practice, unlimited, as long as you work for the U. Is that correct?
That is correct.
Dr. Hanson.
Yes, sorry.
Senator Mayor.
And so is there a pathway? Because it seems like if someone comes and is practicing, but they don't want to work at the U anymore, but they've been practicing for years, is there a pathway for this person to continue practicing vet medicine outside of the U? Or once they quit, they're done, they have no other options?
Dr. Hanson.
Thank you, Madam Chair. Senator Mann. So the existing pathways will still be in place. So someone who is trained at, for instance, another, like, let's say Louise, who is trained in Munich, once she passed boards and was board certified as a specialist, she is potentially eligible to get a license under our current statutes. And I guess that question is whether that would still apply here. But there's also other pathways for people to obtain a veterinary license in any state in the nation, and that's to go through the ECFVG or PAVE programs, and I forgot what those initials stand for, but there's two pathways for them to be able to get a license to be able to practice in any state in the nation. And so those two pathways are still there and available for them. What we're trying to address is that people fresh out of residency, the people that we want to recruit for our faculty positions, have to wait maybe up to a year or more before they could work in this state, whereas they could go work in Kansas right away. And so they have that competitive advantage over us.
Mm-hmm.
Senator Mann.
Madam Chair, and is there no cost to the U to verify all these things without the board certification, without all the tests that they would usually need to take in other pathways to practice?
Dr. Hanson.
Thank you, Madam Chair. Senator Mann, so the cost would be borne by the individual for supplying their credentials, but that's not different than it is for other people applying for a license. They still have to provide either their credentials that they graduated from an ABMA accredited school, or now they would need to provide their credentials that they graduated from a school, for instance, in Munich. And so the burden for the university is similar, and the burden on the candidate is similar. This is just opening up another pathway.
Senator Mann. Any other questions? Senator Kupec, any final thoughts?
No, I appreciate the discussion about this. I think it's something, we can continue to draw attention to, and I appreciate support for the bill.
Well, thank you, and I appreciate your testimony. It does seem like a very important concern and one that we can address this year. So this bill, Senate File 1773, will be laid over for possible inclusion in a future bill. Thank you.
Thanks.
And next, we have Senate File 3546, Senator Pappas.
Okay. Thank you.
Welcome to the committee, Senator Pappas.
Thank you, Madam Chair and members. It's a pleasure to be here in front of your committee. The bill before you, Senate File 3546, is really here because there's an urgency, and let me explain. Licensed traditional midwives have been licensed in Minnesota since 1999 and have been ordering and administering the medications listed in their formulary in statute for over 2 decades. Licensed traditional midwives are licensed by the Board of Medical Practice. Over the past several months, multiple suppliers have stopped selling important medications to licensed traditional midwives due to an interpretation of the midwifery statute. Section 147D.09 is clear that licensed traditional midwives can administer the specific set of medications named in the statute, but the statute is not clear that licensed midwives are also authorized to purchase those same medications. After review by the Board of Medical Practice and the Board of Pharmacy, it was determined that additional language was needed to clarify that a licensed traditional midwife can obtain and possess the medications that they're already authorized to administer. The purpose of this bill is to provide that needed clarity. And why it's important is because all these suppliers have now stopped selling the medications to the licensed traditional midwives. There was still one left, and they just announced they no longer will be selling that. So it's very simple. Section 1 of the bill adds the words obtain and possess. Section 2 of the bill adds language to the legend drug section of the Pharmacy Practice Act to be consistent and to clarify that a licensed traditional midwife can only administer medications named within their statute and operate within their defined scope. In other words, they do not have broader prescribing authority. The original intent of the law was to allow midwives to obtain and possess the medications they administer. I know this is true because I worked with Senator Abler when he was in the House on the original licensed traditional midwife statute. The bill does not change anything related to the practice or the scope of traditional licensed midwives. So it's a technical bill that simply clarifies that licensed midwives in Minnesota can continue to purchase the same medications they've been using for the last 2 decades for their midwifery practices. And I have with me Rebecca Polston, who is the owner of Roots Community Birth Center, as my testifier.
Thank you, Senator Pappas. Ms. Polston, please state your name for the record and proceed with your testimony.
Good morning. My name is Rebecca Polston. Madam Chair and members of the committee, I'm a licensed midwife, and I'm the president of the Minnesota chapter of NACPM, which is the National Association of Certified Professional Midwives. And I'm also the founder and the owner of Roots Community Birth Center. Roots is a freestanding birth center in North Minneapolis where we serve low-risk birthing families throughout the prenatal period, birth in our facility, and postpartum. I also have practiced home birth in the past, but spend all my time now in my own practice. Licensed midwives such as myself practice in home birth settings and birth centers, like I said, across Minnesota. We're not just in the urban setting, we are very diffuse across the state. We are chosen providers for expectant families all over the state who have healthy, low-risk pregnancies and opt for home or birth center. As Senator Pappas stated, licensed midwives have recently lost our ability to purchase the medications listed within our formulary. This issue started over a year ago, but has recently become more urgent as we've lost our suppliers. As a result, licensed midwives in Minnesota, we don't have a place where we can purchase the medications as a part of our practice right now. As you might imagine, the situation is very concerning for both midwives and the clients we serve. Many midwives are now relying on their current medication inventories, but those are limited. We are foreseeing significant disruptions to midwifery practices in the near future. Needless to say, this is distressing for both midwives as well as their clients, who may soon face the unwelcome choice of having to make a different plan with a different provider for their upcoming births. This bill would prevent an unnecessary and harmful disruption to midwifery care across the state and allow midwives to continue their crucial maternal health care practices as they have been for the past 2 decades. On behalf of licensed midwives across the state and our pregnant clients, we want to thank Senator Pappas and Senator Abler for their long historic support and for bringing this legislation forward. We would be grateful for the support of the committee today on this bill. Thank you.
Senator Pappas.
Thank you, Madam Chair. Ms. Polston, would you give them an example of the kind of medication that's really important to your practice?
Yeah, a
Ms.
really basic
Polston?
one is, oh, I'm sorry.
She just said your name.
Go ahead.
Thank you, Madam Chair. Vitamin K is a really simple one. This is a standard medication that's given to newborns at the time of birth to reduce the risk of hemorrhagic disease of the newborn. It's a very standard, low-cost medication that's given around the time of birth. Another one would be Pitocin, which is the first-line drug that's used to prevent hemorrhage or to treat a hemorrhage, which is an acute situation that we use to keep it from becoming emergent.
Thank you. Members, do you have any questions? Senator Abler?
Well, Madam Chair, are there any more testifiers?
No.
Okay. Well, I'm sorry I was out of the room. So this whole thing has been, I think somebody mentioned it earlier, but then Representative Pappas tried to work with Senator Solon a long time ago, wasn't it, to try to get this to go?
Senator Flynn, I think
Senator
it was.
Pappas?
Oh, Senator Flynn.
Yeah, sorry.
Okay, yeah, sorry. But, and so this has been going on. It was like 20 years ahead of when I showed up, and then, you know, punk freshman Abler shows up and Senator Pappas, and so we're so happy to get this to go. Governor Ventura, who was actually unknown to many, quite a thoughtful expert on midwifery practice, declined to sign the bill. and so And so it went into law without a signature. And then Secretary of State Kiffmeyer entertained a room full of families in her office over at the State Office Building while she unrolled the bill. So that was kind of a happy thing. And I'm happy we can fix this. I'm disappointed that we even have to be doing this. It was quite a wonder of collaboration. I worked with the MMA, and they were concerned but really thoughtful at the end, talking about suturing and medications that they would need, and it just wasn't a problem. And then I'm not going to criticize what happened in the meantime. But I think this bill fixes something that's not a problem to get technically correct. And so I'm really happy that you can get back on track and help give women and families an option to give birth in many places. We have one of the most, I think, innovative traditional licensed traditional midwifery laws, I think, in the country. You can get it by apprenticeship and then pass the national test and have to have so many births. And it's pretty stringent. You can't just show up and become one. Or you can go to the schooling part and then get your number of births. And so it's, I don't know, it was a pleasure back then to work with such a complicated bill with, with Sandy and the community. So thank you, Madam Chair. I'm just happy we can keep it on track after 23 years or whatever it's been. So thank you.
Thank you. Senator Pappas.
Just a few comments. Just a little personal note is, and Senator Abler, I think, has also done this, is my 3 daughters were all born at home with midwives. And my youngest daughter became a midwife, and she does both hospital births. She did. And now she has her own home birth practice in Israel.
Interesting, yeah. Any other member questions or comments? Well, I'm glad that we are able to take this up right away this session, and we will be passing this to the floor, and we'll try to get action, get it taken up on the floor. I know that the House is also hearing it today, so we're hoping that we'll have it available to be able to take it up on the floor soon. If there are no other questions, I didn't mention earlier, but Senator Morrison is on Zoom. Members, we will take a vote on Senate File 3546. So the motion is that, and I'll make for you, Senator Pappas, that Senate File 3546 be recommended to pass and be referred to the floor. Any questions? All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail. Senate File 3546 is passed and sent to the floor.
Thank you, Madam Chair. Thank you, members.
You're welcome. Thank you. Next, we have Senate File 3691, Senator Hoffman. He was, maybe the sergeant's, yeah, maybe he can be retrieved. Senator Hoffman, Senate File 3691.
Madam Chair and members, I was going to bring an A2 amendment. There was a couple of amendments, but I think in the interest of negotiations and conversations, I think we just bring the bill as is, because we're still having a conversation about what do we do? Do you combine them? Do you do on the agreements, the not agreements? And then looking at the A2, thank you for your work on that. But the down part of it, the half, there's a half and a 50 that just got, and we'll fix that. And you got 20 days to fix this. And so when it comes to markup time, you're going to have the Board of Social Work, and then you have the Association of Social Workers. Senator Utke, Senator Mohamed, and I have been the 3 on this, and we're saying, let's, you guys need to work this out, right? And this is what we need to just go in here. So what I plan to do, as to your communication this morning to me, was bring the bill forward, your separate bill. We'll put it out for, lay it over. Zainab Mohamed brings her bill forward, lay those out, and then you have 2 bills now at your purvey. And then when it comes time to markup, it is hoped that things are done for you to be able to add that in, because the board needs to act on some things this year. We know that. And so if Senator Utke, if I misspoke in anything of our agreement, then, please correct me, but I think that's as close as it's going to be. So with that.
And Senator Hoffman, I'm sorry to interrupt. I just want to say that this bill has to go to state government. And so, but it doesn't affect the way that you're talking about.
Nope.
Continuing the negotiations. I just wanted to make sure that people were aware. We will take a vote on that, and then the other bill will be laid over. So go ahead with your presentation. Thank you.
So then we'll leave it as is. If it has to go to state government, it's still going to have to end up coming back here anyway, and you and us, we will need to do something. So thank you. This is Chair Wicklund and members. There's proposed changes on the provisional licensing statute. There's creating an alternative license pathway without the national exam for social workers. And the changes include eliminating the criteria of provisional licensure, and also in lieu of exam, the provisional licensure maintains 2,000 hours of supervised practice hours. In addition to expanding access for all individuals with social work education to obtain a social work license. That's the core of this whole argument. It's you want two entities that want to see that happen. There's a recodification, and this is the biggest part, is why the board is in, is the Minnesota Statute 148D, aligning disciplinary language updates to current social work statutes. That's in 148E, and so they need to do that. This is recodification here for a lot of people. So there are two bills that, of course, I just opened up my conversation with that Chair Wicklund, social workers. But there are a couple of folks here. In your handouts, you'll see letters of support, Board of Social Workers, Amber Robertson, Delia Johnson, Potter Vang is a social work professor, and then Jennifer Henkel is one that just talking about some of the inconsistencies there. So that bill I have for you, Madam Chair and members, and I don't know if Ms. Yang from the board is going to come up and talk about.
I have two testifiers listed, Kate Goodman and Yua Yang, if you both want to come up and then provide testimony. Thank you. Welcome to the committee. And Ms. Goodman, did you want to go first?
Sure.
Please state your name for the record, and then go ahead with your testimony.
This is Kate Goodman. I apologize for my frog voice today. I've managed to not recover from the Minnesota crud that has probably made its way around most of our families. So, Senator Wicklund, committee members, thank you for hearing this bill today. As chair of the Minnesota Board of Social Work, I personally, and on behalf of my board members, peers who approved the creation of this bill, wholeheartedly support Senate File 3691. I additionally need to share with you why this bill, sponsored by the staff and members of the Board of Social Work, is so important. When others refer to social work as the helping career, I quickly offer them the language of career focused on systemic change. That systemic change can come from within an individual, within a family unit, a program, a community, a process, an organization, and especially within a policy. To say that Minnesota board members pursue systemic change is an understatement. In just the past several years, 5 Minnesota board members and staff have individually volunteered their time on the board of directors at the Association of Social Work Boards, which is the organization that creates and monitors the social work professional exam. And 3 times that number have volunteered with various committees within the organization. The Minnesota Board of Social Work has worked tirelessly and often against very strong opposition to create systemic change, to offer an alternative assessment of basic level competency beyond a tired and failed tradition of a professional exam. Do professional exams offer some individuals the opportunity to demonstrate competency? Of course. But as you've heard, and I'm sure we'll continue hearing more today, the exams create significant barriers to offering the public of Minnesota the best options for social work practice within the state. The members of the Board of Social Work are determined to continue pursuing a truly equitable, safe, and viable option for multiple pathways to social work licensure that includes an exam or an exam-free option. Until then, we have worked to be as creative as possible with an existing pathway through this provisional license. This option allows individuals to forego the exam requirement and instead engage in direct and supervised practice in order to pursue a permanent license. As an organization charged by the state directly to protect the public, and from a safety and compliance perspective, direct and supervised practice is truly an important part of social work practice that does more good than harm. Not any different than the screen time settings I maintain on my teenagers' cell phones, by the way. And it can demonstrate a higher level of basic level competency than an exam ever could. Due to the complexities of operationalizing this significant and momentous statute change, Senate File 3691 will very accurately offer the most efficient and effective path to reducing barriers to licensing while maintaining the important goal of public protection. Please also let the record show that the letter in opposition from ASWB was submitted on outdated letterhead that lists Thomas Brooks and Mary Weaver on the board of directors, neither of which is accurate and both of whom support this bill. Thank you very much.
Thank you. Ms. Yang, please go ahead, state your name for the record and begin.
Thank you. My name is Joy Yang, and I'm the Executive Director for Board of Social Work. Madam Chair and members of the committee, thank you for your time today and allowing me to testify. The Board of Social Work's mission is protecting the public through licensing and regulation of the social work profession. And the board licensed over 17,000 licensees and has 4 different license types. And I know today we are here in support of this bill to expand provisional licensees' eligibility, right? And just historically, provisional license, it's been in existence for 16 and a half years. It was first implemented in August of 2007 after the board was commissioned to do a study around what would be an alternative pathway to address the exam disparities. And one of the creation out of that study was to offer provisional license for refugee and immigrant population who are foreign-born, speaks English as a second language, and struggle to pass the exam. So they would have had to take the exam at least once and not pass. And on an annual basis, the board issues roughly between 40 and 50 provisional license a year, right? And so it's not accessible compared to 17,000, licensees that we have for others. And the board recognizes that, with the workforce shortage, the exam disparities that continues to exist, that we start pursuing this legislative change about a year ago. And we heard from individuals who were struggling to pass the exam and are not missing the passing score by a lot, by 1 or 2 points from that. And we also recognize our demographic environmental changes are evolving over time, and that individuals may not necessarily be foreign-born, but English is still their second language at home, and that they're still struggling to pass the exam. And so we've taken this into consideration. We've heard from individuals who work and of themselves are deaf and hard of hearing who are struggling to pass the exam because English is not their first language. And so we've taken all that into consideration and have from you a proposal in which the board supports the dual pathway to social work license. It still maintains its licensure by exam pathway, but we are also proposing in front of you the provisional license, which is to remove all the foreign-born, communicates English as a second language, and needing to attempt the exam at least one time pass. Well, one of the things that we are strongly maintaining is the supervised practice hours, right? Because we know that that is in lieu of the exam. That's also an option for individuals, is to have an opportunity to have their skills be assessed by a board-approved supervisor who has completed the 30 hours of our required supervision training. And that it still requires the 2,000 hours of supervised practice for the licensee, in which at the end of that period, the supervisor then could do an evaluation of the licensee. And so we feel strongly to maintain that supervised practice as a competency measure and to assess for minimum knowledge of the licensee. And so some of these things are changing, but I think that we are maintaining things that are also important to ensuring that we protect the public, as our mission. One of the things we've heard, as we currently still have provisional license, is from licensees who have had the provisional license, is that it allows them, if their goal is still to pass the exam, the provisional licensee allows them to continue to practice in the field. For example, if a student has an internship and they're offered a job and they're struggling to pass the exam, they can still get the provisional licensee, practice under that, and have up to, our provisional license currently has up to 3 years to complete those supervised practice hours. And so it allows them to continue to work, to support, themselves and or family. And so, that's as a benefit to, this provisional license. It also, as our board chair addressed the exam disparity. I feel like initially it was, provisional license was to address exam disparity. We also know the Association of Social Work Boards, or ASWB, did a data release about exam, that included exam disparity, especially of our providers of color. And we recognize that the board has had thorough discussions, around that, and part of this change to eliminating these criteria for provisional license is to hopefully increase the diversity in our workforce, right? At the same time, and allowing that, I think in the letter that I submitted showed what our Department of Health workforce data, displays that our social work workforce is not very diverse. And I think that it doesn't, it limits access to our community who are seeking maybe culturally specific, services, right? All those things, it doesn't allow that. I think also in our whole recodifying, our language, we've also added, some flexibility with supervision, allowing the virtual supervision piece. And I think that also increases access for allowing somebody, if you don't have a supervisor with maybe a specialty in terms of supervision, or just somebody who maybe is of your own cultural or ethnic identification, that virtual supervision allows you to seek that out in other communities that may not be close to your home, right? And so I think some of that allows that supervision flexibility, in which we currently allow in our other chapter of social work statute. And so we want to bring that together, and making that option be open, especially when we're thinking provisional, is to really try to increase our social work licensee and workforce. And so I think that one of the things to, when I look at social work, because I am also a licensed social worker who've practiced in many of different settings prior to coming to the board, is that social workers practice in so many different settings, from long-term care to outpatient settings to, counties to hospitals, and their scope of practice, because as a board, we license individuals on a bachelor's level to master's level licensees, and that we know that social workers are essential community providers, and that we really feel we could do better with, trying to ensure that we offer an alternative pathway to licensure that still ensures, someone is practicing ethically and competently, but, and we've had this, license type for, like I said, 16 and a half years. So I think the board, knows and finds it to be of value, and continue to expand it and to try to see if we can get more social workers, individuals with a social work education license for us. And so I think, just, as a wrap up to this is, again, the board strongly supports our 2 pathways to licensure. I mean, we still say that, support that licensure by exam. We understand that this is also a time where mobility, may be something of value to an individual, and they may want to practice in some of our border states, right? In which I think that allows them to apply for licensure by endorsement if they've actually passed through an exam. I know we have a social work compact that is coming up too, where practice mobility will be important, in joining that. And so we feel strongly in maintaining that, but at the same time, we also feel strongly about supporting an alternative pathway to licensure, because we know that the individuals who are struggling to pass our exam, as documented by all these different reports, and as we've seen from 16 and a half years ago when we started this, that the exam disparity still exists, and that we have to be creative, and I feel like our board has been, and we, like I said, we've had this discussion for past year, have been, meeting with legislators, our community stakeholders, to get to this point of drafting this legislative bill change. So I thank you for your time today, for letting me testify. I'm happy to answer any questions from any of the committee members.
Thank you. And those are the testifiers I have listed. Members, do you have any questions? Senator Ebler?
Well, thanks, Madam Chair. Just a supportive comment. I remember when we passed this piece, and I think had to do with Hmong suicides and cultural connections, and it was, I think, Representative Boudreau was part of it way back then. And it seems like it's working great, and frankly, you just need more supports these days to everybody, and I'm happy that it can move forward. I think it's time it worked, and it seems like a really responsible proposal, especially when you get all the bugs out of the different views, but conceptually, the whole thing is a really good idea. Thank you.
Senator Mann.
Thank you, Madam Chair. I have a 2-part question. I see that the hours have been increased from 37.5 to 50, and then from 3 to 4 per every 160. First part is, are people coming out after 37 and a half hours incompetent, that they need more hours of supervision? And 2, we talked a lot about decreasing barriers. Would this be the exact opposite?
Who would like to, Ms. Yang, would you like to?
Yes, I can answer that. Thank you for the question. I think I'm not saying that they're coming out once they are finishing, supervision, that I would say somebody is, incompetent in that. One of the things, just as a historical context around this, is that all of our supervision hours for all of our different license type came out of a study that was mandated by the legislature for DHS to study regarding supervision hours for board licensee, having a baseline for competency, right? And so it's not a number that we pulled out just randomly out of the air and saying that. The provisional license has not been revised since it was implemented. And one of the things we've recognized is that the hours and expectations for other license types have increased to maintain that minimum basic requirement for supervision hours. Provisional has not changed. And part of the recodifying and looking at that was we also need to align some of that language, but also increasing that to allow additional time for supervised practice hours. And in actuality, when we look at it, most supervision plans, an individual still submits about an hour supervision a week, which is 4 hours per month, which is kind of more of a standard, and we see that frequently on supervision plan. People who are on a clinical track for social work license tends to even submit in more supervision hours than the minimum that we required here. And so it's not a, I would say it's not that they're not they're coming out incompetent, is to align so that we are seeing that they're meeting the same minimum competency levels that are required for other licensee type.
Senator Mann, did you have? Okay. Other members, do you have questions?
Madam Chair.
Senator Hoffman.
That's the one point of contention, that was my A2 amendment, was to go back to that original hours. And you'll hear Senator Mohamed talk about that from the association's viewpoint. So I'm glad you raised that question up, because that's really, I think, the emphasis of that piece of it. So, yeah, I think it would be helpful, maybe the Board of Social Work to follow up and folks to follow up with you just to help get clarification on that. Because we got, what do we got, 22 days left? 23 days?
Thank you. Yeah, I mean, I think that the proposal, it seems like a good one, and I'm supportive of, moving forward with action this session.
Yep.
But I would like the groups to come to agreement. I mean, I think the provisional license, it does seem like there is a need and a role for that, and I'm really glad that there's going to be updating to that, because it seems like, the information that you provided, Ms. Yang, about the demographics of the field, we really need to find more ways to address, getting more people involved, people of color into the field. So I appreciate that that's going to happen. Do you foresee if changes are made? I mean, it is such a very small number of people who are applying for the provisional license. Do you foresee doing more outreach, along with this modernization? Is that going to be part of the work to encourage more people to learn about the provisional license? Ms. Yang?
Yes, thank you for the question, Chair. When we look at our ASWB test data that we get on an annual basis, we don't have the 2023 yet, but for 2022, we get like first-time test taker to like repeat test taker. It will be an option for all of those who currently, as we see, as repeat test takers, right? And just as statistics for all the repeat test takers for 2022 was 479 individuals. And so, I think about, it doesn't mean those individuals can't go back and retake the exam if that's really what they want and want some mobility with their practice, is that they can do that. However, those individuals can also could choose, to just go the provisional pathway, and apply for a license that way. And so we anticipate that we would do some of the things, do education, about these two pathways, right? It's one of the reasons why is we also want the individual to choose, right? And to understand what the implication is about choosing a provisional pathway or a licensure by exam pathway. And we intend to do the education to the community, whether it's virtual or in person, with that piece, and really do tons of outreach education so that individuals are aware. I also know that as a board, we can only license those who graduate from programs, right? And so the other thing that we probably have to do is do some intentional outreach to prospective students, right? Maybe some have heard that you have to pass an exam, and those with extreme test anxiety may say, I'm gonna avoid social work degree and maybe go to a related field. And maybe with this option, they may decide to enroll in the social work program. And with that, we also know that maybe this will also open up the door to, as people from more diverse background also get licensed, that they will also pursue the additional training to become a supervisor, because we know there's a shortage of supervisors from diverse background. And that brings a lot of value to being able to seek supervision if you're wanting somebody with that expertise or that work experience that you can relate to. And so that allows that with the supervision and doing that. So doing outreach on the applicant level to the supervisor level to ensure that, we can increase that workforce, in both areas.
Thank you. Senator Hoffman, did you have any final comments?
Madam Chair, if you wanted an update on the compliance side of it, the board chair, Kate Goodman, would be more than happy to clarify that for the group as we go forward. And if not, then I think disposition of this bill is, A, we're going to lay it over, B, there's also a movement to go to state and local government, correct?
We were planning to have it move, or take a vote on it and have it go to state government. And I don't know if council, if you could state kind of briefly what the reason it has to go to state government, just so the committee is clear.
Thank you, Madam Chair. I'd be happy to. So there's a provision in this bill that subjects provisional licensees to the grounds for disciplinary actions under the larger board as a whole, which includes regulatory oversight and the ability for them to impose and enforce rules related to that, which would be under state gov's jurisdiction. Thank you.
Thank you. So I am comfortable, and we can, we'll take a vote to see if the committee is comfortable with referring it to state government with the knowledge that work will continue. We will hear Senator Mohamed's bill next, and we will continue to discuss language changes. We would be probably, bringing together in an omnibus the different scope of practice or licensing type bills, and so that's the work that would need to go on before we finalize that. But did you have any comments or feedback on that, Senator Hoffman?
Yeah, thank you, Madam Chair. It is then a desire of you to have it come back after state and local government to come back to you to bring into your conversation or possibly bring it up as an omnibus
Yes,
package.
that would be the, we would discuss that with state government as they hear it, that they could refer it back.
So it would be nice, thank you, Madam Chair, for that. That makes sense, because then it's the pathway stopping at state and local government, whatever discussion is that state and local government needs to look at that jurisdiction, just in that chunk. And then everything else is coming back to you. So when it's markup time, we'll be in this position once again, hopefully, correct?
Yes, that's correct.
I got it.
Would you like to make the motion, Senator Hoffman, that Senate File 3691 be recommended to pass and be referred to state and local government?
So moved.
Members, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? The motion does prevail. Senate File 3691 is passed and referred to the Committee on State and Local Government. Thank you. And now we will hear Senate File 3880, Senator Mohamed.
Madam Chair,
Senator Abler?
I'll move the bill to get it in front of us.
We don't have to do that.
We don't?
Senator Abler, we just.
All right, we just do it. All right, fine, never mind that. Thanks.
Yep. Senator Mohamed, please proceed with your presentation.
Thank you, Madam Chair. Good morning, members of the committee. Before you is Senate File 3880, which will address the workforce shortage of social workers by expanding the existing non-exam route of eligibility. The elimination of exam prerequisites will make this pathway optional for all social work graduates. As we try to diversify and expand our workforce, it is crucial to reassess the barriers that impede entry into the vital field. Our current licensure process presents obstacles, notably through the ASWB exam. Licensing exam. This examination, while a standard measure of competency, has shown to create disparities based on factors such as race, age, and accessibility. The proposal within Senate File 3880 is supported by key stakeholders, including the Black Social Workers Association, the Hmong Social Worker Association, and the National Association of Social Workers, which they all seek to alleviate these barriers by expanding the non-exam route for licensure eligibility. By providing alternative pathways that prioritize additional supervision over examination requirements, we aim to foster a more inclusive, diverse workforce. ensuring that all qualified individuals have equitable access to licensure and can contribute effectively to the betterment of our communities. Chair Wicklund, myself, Senator Otkey, and Hoffman have been sort of working through this, and I know Senator Otkey has carried this issue over the years. I think that both bills, the one that you just heard and this current one, have the same goal in mind, which is to eliminate barriers in this field. The main difference you heard a little bit earlier, which Senator Mann questioned, is the amount of hours. We want to keep them as they are because we know that it's working, and to increase the hours would create more barriers for students who are interested in getting in this field, and it is more money and it's expensive considering that this field barely pays anything anyway. And so with that, I have a number of testifiers with me and happy to answer all your questions, and I am committed to working with the board as well as with you, Chair Wicklund, to get this resolved.
Thank you. We have testifiers. If I could have Jenny Arneson and Antonio Gonzalez Ogas come forward. Welcome to the committee, and Ms. Arneson, please state your name for the record and proceed with your testimony.
Thank you. Thank you. So good morning, Chair. Good morning, Senators. My name is Jenny Arneson. I'm a social worker, and I represent the Minnesota chapter of the National Association of Social Workers and other professional organizations united as a coalition of licensed social workers. We believe that social workers make important contributions to the workforce in many different settings, and we need more of them. Right now, the only licensure path open to most graduates includes passing an exam. It's been shown that this exam is not fair for everyone. In 2022, ASWB, or the entity that develops the national exam, released data confirming disparate pass rates based on race and age. Other barriers include offering the test in English only and a difficult approval process for the sorts of testing accommodations that are common elsewhere. There are also a limited number of testing sites, making access in greater Minnesota more difficult. As you've just heard, in Minnesota, there is another pathway to become licensed through additional supervision instead of passing the exam. But that is currently only open to a small group of people. We want to expand eligibility for this provisional pathway to all social work graduates. While this bill is similar to the one you just heard, the key difference is supervision requirements. This bill maintains the hours currently required instead of increasing them, because more hours will add, not decrease, barriers for new graduates. Social workers cannot always find a qualified supervisor with their employer. To address that problem, it is common for social workers to pay out of pocket, anywhere between $30 to $125 an hour. Social workers are not well paid, and adding 12 and a half more hours could cost a new social worker over $1,500. Not only is it costly, supervision is a significant investment of time. In its current format that spreads out the hours, it takes at least a year and up to 3 years to complete the required hours. Because there are Minnesota social workers who already entered the profession through provisional licensing, we know this is effective in developing competent social workers. Social workers have robust training and a licensing process in Minnesota. The bills heard today will allow new social work graduates some flexibility to choose a licensing path that best matches their professional needs and goals so they can join the workforce. Thank you.
Thank you. Mr. Gonzalez Ogas, please state your name for the record and begin.
Thank you, Madam Chair and members of the committee. My name is Antonio Gonzalez Ogas. I am a licensed graduate social worker in the state of Minnesota. I am a first-generation college graduate. I have been a bilingual social worker for 27 years, specifically at MSW, since graduating from the University of Minnesota in 2018, where I earned my third college degree. I'm currently clinical director at Sci-Fi TMS in Edina, Minnesota, which is a title I recently earned after growing our therapy department from a team of 1 to a team of 4. I have been an active, successful therapist thriving in a private practice setting since passing my LGSW a little over 3 years ago after 4 attempts. I've been eligible for my LICSW licensure for almost a year and have taken and failed the LICSW exam twice so far. By the way, that is one of the most difficult admissions I've ever had to make publicly in my entire life. Not even my mother knows that yet. I am an experienced, educated, knowledgeable, and intuitive social worker. Since becoming eligible to sit for the exam, I've already accumulated another year's worth of experience in this field, along being supervised by a psychiatrist. I'm not a nervous test taker. My photographic memory has augmented my ability to achieve academic success over the years. I have studied hundreds of hours in preparing for the last 6 standardized social work exams that I've taken and have spent thousands of dollars on taking the ASWB exam, paying for test prep materials, and paying for external supervision that none of my employers covered, and for all other requirements to achieve licensure. ASWB and test preparation businesses are thriving off the sweat of hardworking people. However, I sit here humbly before you this morning to tell you that I am struggling to find the temerity to take my 7th standardized social work exam, because it appears that none of my skills, education, studies, or instincts are catapulting me into achieving the success that I know I can have as an LICSW. This isn't only painful and catastrophic for me, but for my clients who are often seeking a male, bilingual, queer person of color as their therapist. This exam is a huge barrier. There must be another way to achieve this status. One size does not fit all, and there are consistently others like me, specifically people of color, who are in a similar predicament as I am. I cannot unlearn 27 years of social work experience to pass this one test because there is one best solution to a question. Social work is about problem solving and assisting a client through their lens, not mine. No textbook, professor, supervisor, or test writer will ever truly know what the correct answer is all of the time. I'm asking you today to please consider adding an additional pathway to the LICSW licensure process. Thank you.
Thank you very much for sharing your testimony. There are 2 other testifiers. If you could stay close, but let the other testifiers come up. Nicole Helland and I'm sorry if I mispronounced your name, Kaunumua. Welcome to the committee, and please state your name for the record and begin.
Thank you, Chair Wickland and committee members. My name is Nicole Helland. I'm one of the social work managers at Children's Minnesota and also a clinical social worker myself.
And please speak really close to the microphone.
Will do.
Thank you.
I appreciate you having me here today to express our support for Senate File 3880, which would remove barriers to hiring qualified social workers that represent the communities we serve. Children's Minnesota is the state's largest pediatric healthcare system, serving an incredibly diverse patient population. We employ more than 5,000 people, including nearly 90 clinical social workers supporting our emergency departments, medical units, inpatient mental health, partial hospitalization, pediatric clinics, and outpatient therapy teams. These clinical social workers are dedicated to ensuring that Minnesota children can get the care they need in an environment where they feel seen and included. An essential part of creating this environment is recruiting and retaining staff that reflect the communities our patients and their families identify with. Currently, 1/4 of Children's Minnesota employees are people of color, and our goal is to increase that to 34% in 2024. Right now, we have 15 open positions seeking LGSW or LICSW candidates, and current provisional license eligibility requirements, as well as demonstrated bias within the ASWB exam, continue to limit our ability to recruit internal and external candidates. In recent years, we have offered positions to internal candidates who identify as people of color and have demonstrated many years of dedicated employment at Children's, one as a unit coordinator and another as a nursing assistant. They completed the educational requirements and internship hours to join our social work team, but have been unable to pass the ASWB exam despite taking it multiple times. These women include those that represent underserved populations and have multilingual skills that would greatly improve our patient care experience and enhance our care team. They were ready and willing to help address the need for additional clinical providers for acute mental health, including difficult to fill evening and night shifts, but we have been unable to hire them. As a teaching hospital, we have a strong social work internship program, and we know that hiring clinical interns following their placement is the optimal way to support workforce stability. I learned just this week that one of our interns did not pass their ASWB exam, preventing them from being hired into one of our critical open roles upon graduation. Barriers like the ones I've mentioned have also threatened our ability to retain employees and offer opportunities for advancement and leadership, which is key to creating a truly equitable work environment. Recently, we celebrated an employee passing the ASWB exam to obtain her independent clinical license. Then the employee, who identifies as a person of color, shared with me that it was the 4th time she had taken the exam, which meant she had to bear the burden of multiple exam fees, promotional delay, and lost income. The burden of the exam, both emotional and financial, has prevented too many qualified social workers from beginning or advancing the careers they have trained for, and it has impacted our ability to effectively and efficiently serve our community. To address the healthcare workforce shortage we are seeing in Minnesota, more needs to be done to make our systems and processes more equitable. The changes outlined in this bill are the kinds of innovative and necessary changes that need to be made to recruit and retain the workforce that our patient families need, both today and in the future. Thank you, Senator Mohamed, for your leadership on this bill, and thank you, committee members, for your time.
Thank you very much. Ms. Moa, please state your name for the record.
Good morning. My name is Gaunu Moa, and I am an assistant professor in the social work department at Augsburg University in Minneapolis. I'm speaking today in support of Senate File 3880, which proposes changes to the provisional social work license. One of those changes is to eliminate the ASWB exam because it is a major barrier for graduating students. As I prepare undergraduate and graduate students in their final years, there's a great fear of failing the ASWB exam. For first-time BSW test takers, the pass rates are fearful. For those who identify as Asian in Minnesota, the pass rate is 40%. For Black individuals, it's 38%. For those who identify as Latino, the pass rate is 67%. For Native Americans, it is 70%. The exam is only administered in English, and so for non-English speakers, the pass rate is 53%. In fact, the CEO of ASWB, which develops the exam, admitted in a public statement that ASWB exam pass rates are evidence of bias and called their own pass rates jarring and disappointing. In addition to taking and failing the exam, it is costly. Depending on which exam someone takes, they pay the same amount every time they retake the exam, ranging between $230 to $260. Failing the exam also impacts their livelihoods. I've had former students tell me they regret this degree because the ASWB exam is a barrier to their ability to find work with their social work degree. I know former students who have left the profession altogether. I'm embarrassed to admit that I have suggested to former students who are preparing to take the exam a 3rd or 4th time that they get a job at a coffee shop or a grocery store so that they are not practicing out of compliance. ASWB often likes to describe their exam as valid and reliable tools to assess knowledge, skills, and abilities in order to protect the public. They believe that examination is best practice, but we know that across K-12 education, university admissions policies, and other professions like teaching and law, many are calling into question the use of standardized testing. In social work education, programs undergo an extensive accreditation process. Part of that accreditation process is to ensure that programs offer a robust internship experience. These internships involve real-world settings and have multiple checkpoints to evaluate students. Students receive feedback from faculty and their field supervisors who are all licensed social workers. It is through supervised practice that students receive guidance and oversight that can be more effective in evaluating a student's readiness for professional practice. The current supervision hours is sufficient. We should not increase arbitrary hours and create more barriers. Additionally, the ASWB exam cannot provide this type of guidance and oversight. In actuality, the ASWB exam does not ensure public safety at all, but rather keeps people out of a profession that desperately needs people in a workforce shortage, in escalating crises among vulnerable people and communities, and in an increasingly diverse state. I urge you to support Senate File 3880 so that we can reduce barriers to social work licensure. Thank you for your time this morning.
Thank you very much. And that's all of the testifiers we have. Members, do you have any questions about this bill? I don't see any questions. Senator Mohamed, did you have any other thoughts that you wanted to share?
No, I appreciate you, Chair Wicklund, and I appreciate the board for somewhat working with these folks. I think over the years, these folks have been coming to the board, and they only meet about 5 times a year, over and over again, asking for different ways for them to be licensed. And I think what we heard today is these folks are ready, competent, but the exam is a barrier, and that as long as they're able to get through school, do their hours, they're able to serve our communities. And so I hope that we can get to something, because increasing the hours will increase barriers, which is the whole point of this bill, is to eliminate that. So I appreciate you.
Thank you. Yeah, and I do, it's just very striking that Minnesota identified a need for a provisional pathway, so many years ago, and identified the disparity in the test results at that point. And, 16 years later, whatever was mentioned, that it's still an issue. It seems like that's not being addressed. And so we need to re-examine. I think you're re-examining the process and looking for new ideas is important. So I look forward to you working together and working with the board, and we will see what we come up with. This bill does not need to go to the State Government Committee, and we can lay it over. So Senate File 3880 will be laid over for future consideration.
Thank you.
And thank you very much for coming to testify today. Members, we have no other business before us. Next week, we will only be able to have committee on Thursday because of the precinct caucuses on Tuesday night. So we will set up an agenda for Thursday, but don't expect that we will have meetings before that. So seeing no other business before us, this meeting is adjourned.